Hey everyone, and welcome to today's session. If we are ready, we're going to focus on chronic pain and some management of that. We're going to first tap into our bodies and see what's coming up, what feelings, emotions, sensations have been happening, whether it's twitching or pain or anxiety or anger or resentment or sadness or grief. We can give that some focus. And as we give it focus 100%, we can see what it wants to tell us, what it needs. We can see what we can do to help that sensation. Maybe it wants us to do something. Maybe it wants us to just sit there with our hands and support that sensation, or that twitching, or that anger, or that pain. And we can nurture it and listen to it. And when we are ready, we can say, are we ready to explore chronic pain and how we can work with that? So there are different forms of chronic pain that come up after chronic stress and after abuse and trauma. Very often they show up either in the head, so migraines or back pain, pelvic pain or sciatica. We also have anxiety that comes up as kind of a chronic pain in itself. And so when we deal with chronic pain, a big part of it is tapping into dissociations. We do not want to focus on the area of pain because we're human beings and we are wired to want to feel okay and good and pleasure, and we don't want to focus on pain. And also in our society, when somebody asks, how are you doing? You're like, I'm doing awesome, I'm doing great. Nobody says, I'm in pain, I'm doing terribly, I'm so sad, I need a hug right now. So let's do that for ourselves. And so with migraine or with any type of chronic pain, there is that physiological aspect and there is that psychological aspect. And so when we do our exercise of working on the energy aspect, where we sit with it and we listen to it and we give it voice, and then we respond to that voice and we nurture it, and we say, what do you need? I'm here for you. I will do what it takes to help you feel better, right? So we do all of that whole process as we're tapping into the energy aspect of it. And physiologically, there's physical things that we can do as well with our hands. And so we can work with chamomile, or we can work with other oils like lavender oil that can be very soothing and calming. And if that's something you want to do, you can do that. If there's that pressure in your head, you can dig deep into your head and focus on bringing it up and out. And if it's that pressure in your back or that pressure in your pelvis or that pain, we can focus on massaging deep and then giving an outward motion. And while you do that, you can envision that this energy and this trauma is leaving and is going away. And so we can go ahead and practice that a few times. So you can put your hands on that site, dig into it really slowly, really deeply with a lot of pressure, and then you can go out. Okay, so let's do that a couple of times. How about 5 times? 1, 2, 3, 4, 5. And another type of chronic pain that shows up when it comes to women could also be severe premenstrual cramps. There is that link between trauma and very intense PMS symptoms. So what we can do is also focus on putting some chamomile or putting some lavender oil in our hands, and then helping soothe the area as well, so around the pelvis, to say, okay, I'm going to give this space and this skin some oil. It's also healing and relaxing for you to smell, so that's an added bonus. And you can kind of massage the area and put out the energy. So I hope that is a small trick that can help you. We can take a moment and tap back into our bodies and see if giving that moment of attention and space and massage to our body felt good. And any feelings of repair that says my body is self-healing and can repair itself, or that says pain is not forever, it goes away. We can sit with any of those feelings and see how that feels in our body. Thank you for joining me today. I look forward to seeing you again soon.